My name is Adedayo Joseph. I am a consultant clinical radiation oncologist with the NSIA-LUTH Cancer Centre. I am also the head of the clinical research program and the head of the Pediatric Radiation unit of the center. Oncology for me was something that I was curious about. As a medical student, I found it very interesting as early as when I took pharmacology. But I found that over my experience in the medical curriculum, I just didn't receive enough exposure to oncology. And so I found that I had not for me, when I'm curious about something, I want to get to the end of it. I want to get to the depth of it. I want to understand it. And that really was what it was. I just hadn't received enough knowledge to feel as though I had conquered it. And that was why I held on, so to speak, to oncology. As head of research, my role is really just to support, encourage anybody who is interested in conducting research at the center. One of the huge gaps in cancer data worldwide, is the fact that there's very little African representation and very little West African representation in the data. So we are making decisions based on studies that have been conducted in people who are different from us, who have a different genetic makeup than we do, who have different circumstances and different levels of access than we do. And so research is the foundation of improving cancer care outcomes in Africa. So my role in NLCC is to support that, is to support every researcher, is to open the doors to people who want to collaborate with us with research, and to work with the team to make sure that we improve cancer outcomes in Africa. Pediatric radiation is a part of oncology that is deficient in most parts of the world. It's a problem that's not unique to Nigeria, it's not unique to Africa, and it's not even unique in high income countries. There are fewer pediatric radiation oncologists than most other specialties when you compare. I've always had a love for children. People used to think I was going to become a pediatrician, and I sort of thought I had escaped that, but ultimately came back to also have an interest in pediatric radiation, even with my oncology. I've worked for a long time with children, clinically and non-clinically. And my role now as head of pediatric radiation is to make NLCC a destination site for children who need radiation treatment in West Africa. We have a program for children that is different. Nobody else has that sort of program. And it is different on both the clinical level, in terms of the level of expertise that we bring to the job, in terms of the level of trainings and exposure that we have, in terms of the international collaborations that we employ, but also in terms of the social factors, in terms of the human face that we bring to it. Children are not mini adults. And when we treat them, we keep this in mind. Our treatment is completely tailored to that child, every single child, every single time. Women in medicine in general, women in science, women in medicine have been quite put upon in history if you look through the times. But we've also been some of the strongest forces for improving science, for expanding data and expanding knowledge. Everybody knows of Marie Curie, and from her time till now, we still find ourselves in a phase where there aren't enough women practicing radiation oncology. I think one of the challenges is imposter syndrome. I think a lot of women question and doubt themselves and doubt their ability. And I see these in the women around me, the young ones, my colleagues. I see that a lot of times we doubt ourselves more than our counterparts. I think our biggest challenge is ourselves. I think we as women have to learn to believe in ourselves. We have to not be afraid to have a voice, not be afraid to go after what we want, not be afraid to go after our dreams. And I think we have to put away the misconceptions and the ideas that society tries to put on us. One of the most common questions I get asked as a woman is how my husband feels about my schedule, about my work hours, about the amount of trainings and studying I have to do. I do admit to having a very supportive family that I'm very grateful for, but I note that very few people ask him that question. Very few people ask a man how his wife copes with his schedule, with his work hours, with his training and his studying. They hardly ever get asked that question, but women get asked that question every single day. And so they make you feel as though you need to feel guilty for the fact that you work hard. I work hard and I also love my family, and I should be able to do both. Oncology practice and cancer care has come a very long way in Nigeria, but we're just at the cusp. We are at the brink of a breakthrough that is going to change the face of oncology. It's going to change the way that people approach cancer in Nigeria and in West Africa. We have more access, we have more technology, we have new techniques, new machines, we have more specialists, and it is only growing. So we are going to get to the point where cancer is no longer stigmatized. We're going to get to the point where people understand that for many cancers, there is treatment, and for many of them, you can become a cancer survivor. I tell people in my clinic every day, there are 3 million breast cancer survivors in the world. So it means that this is survivable, and I think that is where we're going with cancer care. For any woman who is interested in a career in medicine, a career in oncology, this is what I will say. One of the first prayers I learned as a child, it's not an actual prayer, but as a child I learned it as a prayer because my father taught it to us and we had to recite it in our homes every day. And it's a poem by Henry Wadsworth Longfellow. I used to think the name was very funny. But it starts by saying, "The heights by great men reached and kept were not attained by sudden flight, but they, whilst their companions slept, were toiling upward in the night." And it has meant different things to me at different phases of my life. Sometimes it has been literal, meaning that I actually sit up for 72 hours straight of studying. But ultimately, what it has meant to me is that sometimes when you accomplish something, people say, "Oh, wow, she's so lucky," or "Oh, all of a sudden she became this." Nobody sees the iceberg. Nobody knows how much effort. They don't see the churning that has gone on underneath the surface. And so that's what I say to anyone who asks me. The heights by great men reached and kept were not attained by sudden flight, but they, whilst their companions slept, were toiling upward in the night.